Assalamualaikum warahmatullahi wabarakatuh. My name is Fikri Helfian. Today, I want to share you my opinion about COVID-19. Coronavirus or COVID-19 is an infectious disease caused by acute respiratory syndrome coronavirus 2. The disease was first identified in December 2019 in Wuhan, the capital of China's Hubei province, and has since spread globally, resulting in ongoing coronavirus 2019-2020 pandemic. Common symptoms include fever, coughing, and shortness of breath. Other symptoms may include fatigue, muscle aches, diarrhea, sore throat, loss of odor, and abdominal pain. The time from exposure to the onset of symptoms is usually around 5 days, but can range from 2 to 14 days. While the majority of cases produce mild symptoms, some develop into viral pneumonia and multi-organ failure. As of April 9, 2020, more than 1 million cases have been reported in more than 200 countries and regions. More than 329,000 people have recovered, and then more than 88,500 deaths. The virus is mainly spread during close contact and by small droplets produced when they are infected with coughing, sneezing, or talking. This drop can also be produced while breathing. However, they quickly fall to the ground or surface and generally do not spread through the air over long distance. People can also be infected by touching a contaminated surface and then their face. This virus can survive on the surface for up to 72 hours. Coronavirus is most infectious during the first 3 days after the onset of symptoms. Although spread may occur before symptoms appear and in later stage of the disease. The standard method of diagnosis is the real-time reverse polymerase chain reaction of the nasopharyngeal swab. Infection can also be diagnosed from a combination of symptoms, risk factor, and chest CT scan that show features of pneumonia. Suggest steps to prevent infection include frequent hand washing, keeping a social distance, keep a physical distance from others, especially from those who have symptoms, covering coughing and sneezing with a tissue or inner elbow, and keeping unwashed hands away from the face. The use of masks is recommended for those who suspect they have the virus and their caregivers. Recommendation for the use of masks by general public vary, with some authorities recommending their use, some recommending their use, and others requiring their use. At present, there is no specific vaccine or antiviral treatment for COVID-19. Management involves symptomatic treatment, supportive care, isolation, and experimental measures. The World Health Organization or WHO declared the 2019 and 2020 coronavirus outbreak as international emergency public health on 30 January 2020 and a pandemic on 11 March 2020. Local transmission of this disease has been recorded in many countries in the 6 WHO region. Respiratory duct can also produce when breathing out, including when talking, although viruses are generally not transmitted through the air. The National Academy of Science has suggested the transmission of bioaerosol might be carried out and that air collector positioned in the halfway outside people rooms produce positive samples of viral RNA. Droplets land on the mouth or nose of people who are nearby or may be inhaled into the lungs. Some medical producers, such as intubation and cardiopulmonary resuscitation, and cause respiratory secretion to become aerosols and thus result in airborne spread. This virus is most contagious when people are symptomatic. While spread may occur before symptoms appear, this risk is low. The European Center of Disease Prevention and Control says while it is not entirely clear how easily the disease spreads on person generally infects 2 to 3 others. Preventive measures to reduce the chance of infection include staying at home. First, avoiding crowded places, frequently washing hands with soap and water, and for at least 20 seconds, practicing good respiratory hygiene and avoiding touching eyes, nose, or mouth with unwashed hands. They also recommend proper hand hygiene after coughing or sneezing. The social distance strategy aims to reduce the contact of infected people with large groups by closing schools and workplaces, limiting travel, and cancelling mass gathering. Long-distance guidelines also cover that people must be at least 1.8 meters apart. I think that's all about my opinion about COVID-19. Thank you for watching. Assalamualaikum warahmatullahi wabarakatuh.